Hi everybody. Thank you so much for joining us tonight. My name is Sandy Hart. I'm the chair of the Lake County Board, and on behalf of my colleagues on the Lake County Board, thank you so much for being here. This is our fourth town hall since the start of the COVID-19 pandemic, and I hope that we are able to answer many of the questions that you and your friends and neighbors have about the virus, about the vaccine, and what the future may look like in terms of getting us through this pandemic. We're incredibly fortunate to have two people here in Lake County who have dedicated their personal and professional lives to public health, and they each have been extremely busy, as you can imagine, since this pandemic hit in March. I'm really so grateful to both of them for staying late tonight, although I know they work late every night, to answer your questions. So first, we're joined by Mark Pfister. He is the Executive Director of the Lake County Health Department and has close to 30 years of public health experience. He guided us through the H1N1 pandemic, so he is not new to this, unfortunately. And on a side note, he has not taken a day off, including weekends, since this pandemic began back in March. Dr. Sana Ahmed is the medical epidemiologist at the Lake County Health Department and is a licensed infectious disease doctor. If you cannot stay with us the entire time tonight, we will have this town hall available on our website. So please tell your friends and family if you think some of this information might be helpful to them, or you can watch the rest of it later at your convenience. So before we get started, we did have a few questions about why Lake County is perhaps in mitigation and what we can do to make a difference on that in terms of Lake County government and the health department. So please know that Lake County follows the rules set up by Governor Pritzker in the Restore Illinois plan. And depending upon different factors like ICU bed availability, positivity rates, and the number of hospitalizations for COVID-19 patients, our region, which is Region 9, Lake and McHenry County, move in and out of mitigation tiers. So we're currently in Tier 3, like the whole entire rest of the state. And obviously we're hopeful that we will soon move into Tier 2, which will reopen restaurants for indoor dining and allow groups up to 25 people. We did have a few questions that came through, and we had over 1,000 questions. But since this town hall is focused on COVID-19, we won't be discussing those that were outside of COVID-19, but I would encourage you, if you would like an answer to those questions, please do reach out to your county board member, and we are happy to help. Like I said, we received over 1,000 questions, so thank you so much for submitting those. We're going to start with those questions that have been asked by multiple people. And you can continue to ask your questions and send your comments through to the chat button. We have several staff people who are monitoring those, and they'll forward some of those along to me if we have time to ask. So first off, I am going to start with Mark. A lot of people really want to understand what's the timeline for the vaccine distribution. We're hearing all sorts of different dates. Maybe everybody will be vaccinated by the end of summer. Oh, it's going to take much longer. Can you give us, and I know it's just an estimate, but can you give us an estimate for the vaccine distribution, please, and maybe who's in each phase?
Absolutely. And Alex, if you can pull up a slide, but before I begin, I just want to thank you, Chair Hart. It's great being here today. Happy New Year, Lake County. Thank goodness it's 2021. And also thank goodness that we live in the United States of America. We are one of the few countries that has the amount of vaccine that we have, and we have two great vaccines. We have the Pfizer vaccine and the Moderna vaccine. And so we'll get right at this tonight, and let's talk about those vaccine phases. Right now, we're in phase 1A. This is the current phase. What we've been doing since we started receiving vaccine in December is that we've been redistributing the Pfizer and Moderna vaccine mainly to our hospital systems, to our frontline healthcare workers. And additionally, the state has started a program where we're vaccinating both the staff and the residents of long-term care facilities. So that's phase 1A. That's what we're currently in. And so the hospitals are now getting to the second doses of those individuals. And then the health department has also been vaccinating individuals that are not affiliated with hospitals that fit into those healthcare worker roles. And so we're going to be starting second doses next week. So the great news is that for those of you that are in phase 1B, and I'm sure there's a lot of you on here tonight, is that we're expected to begin that in February. So who's in the phase 1B are frontline workers, frontline essential workers, and there's about 1.3 million of those individuals in Lake County. We also have individuals that are first responders in that group, fire, law enforcement. Education really is focused on the K through 12 staff. We also have a number of food processing plants here in Lake County. We have some major corporations, AbbVie, Abbott, Baxter, that are having great manufacturing. Also included in that essential workers are corrections workers in the jails and even the inmates, because we do need to be concerned about congregate settings. Unfortunately, in Lake County, one of the reasons why the long-term care facilities was in that first phase was the majority of the people that unfortunately have come down with COVID-19 that had to be hospitalized and then also unfortunately died were in those congregate settings like long-term care facilities. Additionally, we have postal workers, public transit workers, grocery store workers that have been, are really essential workers. And a lot of those individuals that work in those occupations, these frontline essential workers, are people of color. And they've been dramatically impacted by COVID-19 because they have been our essential workers. And then obviously there's other staff like daycare and shelters that are part of that frontline essential workers. Next slide. So what phases do we go to next and this is not yet finalized by the Illinois Department of Public Health. And by the way, these phases really have been created by the CDC and the Illinois Department of Public Health. Since the beginning of this pandemic, our department has followed the science, and this is just following the science that CDC and IDPH has looked at these groups and figured out how to prioritize. So phase 1C is and we're looking to expect that in spring or early summer. Those are persons ages 16 to 64 with high-risk medical conditions and other essential workers. Then we'll move into phase 2, which is the general population that is age 16 and above.
Thank you. So do you have a sense as we move into phase 2, like how long it's going to take us to kind of get out of 1C and into 2?
Yeah, actually, let's talk about phase 1B, if you wouldn't mind, just real quickly, just to give you an understanding of the 65 and older people. The governor, as well as the federal government, changed it from 75 and above to also include 65 and above in phase 1B. So just to kind of talk about how many people is that, right now in our AllVax platform that we have over 51,000 people that have registered for the vaccine in Lake County. And when we think about it, our population in Lake County over 65 is about 100,000 people. So to vaccinate 51,000 people, it's going to take some time to go through that. So that's why we're saying it's going to take a couple of months to go through 1B, probably take multiple months to go through 1C, and then again, multiple months once we get into the general population.
Got it. So, I know that here in Lake County, we're really fortunate that one of the manufacturers was able to deliver the vaccine directly to us. But can you tell us a little bit about that? So what is that vaccine distribution process? Because I know people have asked me about the different, is it different here in Lake County? Is it different in Illinois? Can you talk a little bit about that, please?
Sure. And Chair Hart, you mentioned earlier on that this isn't my first rodeo with a pandemic, unfortunately. And so we had H1N1. H1N1, we had one vaccine. It was a flu vaccine. Everybody knows what a flu vaccine is. It was one dose. We gave you one shot. And we could actually, because there was a preservative in that flu vaccine, it lasted for a lot longer. So these two vaccines are very fragile vaccines, and they're very complex vaccines. So just to start walking this through, is the federal government actually ships out the Pfizer vaccine and the Moderna vaccine. And as you said, one of the things that we thank the Lake County Board for is that you gave us CARES Act money. And we knew that Pfizer was coming, and we knew we needed to store it at an ultra cold temperature. So we used that CARES Act money to purchase an ultra cold freezer. The Pfizer vaccine has to be stored at -94 degrees Fahrenheit. That is a very, very cold temperature. Your normal freezer does not match that. So because we have that freezer, is that we are able to receive the vaccine in Lake County directly from the federal government to us. So it doesn't go through the state like some of the other health departments across the state of Illinois. So once that vaccine is shipped to us, we put it in our freezers, and then the majority of the first vaccines, we've redistributed it. So we take that, we package it up, and then we send it to another provider like the hospitals. And then once they have it though, that these vaccines only have a relatively short shelf life in the refrigerator. So once they come out of the freezer, Pfizer only takes 5 days shelf life in the refrigerator, where the Moderna vaccine is a 30-day shelf life. But both, we have to use them very quickly. As soon as that vial, and when you put a syringe into that vial, we have to use that entire vial. And so we want to make sure that we have a lot of people ready to go, that we start that vaccination. We know exactly how many people we're going to vaccinate in that time frame. And what we definitely don't want is to have any waste.
Got it. Perfect. Thank you. So speaking about that and not getting any waste, we have that AllVax system, and I know that's going to be really helpful in ensuring that everybody gets their appointments, so it doesn't look, as one person asked, is it going to look like Florida here? No, it isn't. But can you talk a little bit about the AllVax system and how someone will get notified when it's their turn to receive the vaccine? And then how do they do it? How do they schedule an appointment and things like that, please?
Great. And Alex, if you can just pull up the slide so that the public can see it, we're very, very proud of our AllVax system. This was something that, again, my team is just phenomenal, that they thought out of the box. We needed to have something that was not only going to be able to notify you, but also to track the vaccine, allow you to schedule a vaccine. And so if you see on the slide is that we really want everyone to register to be notified when a COVID-19 vaccine is available to you. All of you are on here tonight to find out a little bit more about the phases and when the vaccine is going to be available. But one of the best ways that you can find out information is to go into allvax.lakecohealth.org, or you can email us at allvax@lakecountyillinois.gov. Or if you don't have a computer, that you can call us at 847-377-8130. When you do call that line, we've been getting over 1,400 calls per day at sometimes. So we may not have somebody to answer it right away, but please leave a voicemail and we will definitely get back to you. But what you should do is once you register into AllVax, then we will be able to notify you based on what you input into the system. We're going to ask you your name, your date of birth, your zip code, and then we're going to ask you about some of the conditions, risk factors that you may have. So definitely please make sure you go in and register at allvax.lakeco.org.
Perfect. Thank you so much. So when somebody registers, then they can get an appointment. And where can they expect to receive a vaccine? Will it just be at the Lake County Health Department, or where else would they potentially go?
That's a really great question. And so no, we are looking for every provider in Lake County that provides vaccines to make sure that they sign up and register into iCares. Because one of the things the health department really wants to do is we know if only the health department is vaccinating, it's going to take a long time for our Lake County public to be vaccinated. So we want every provider, and when I say providers, I'm talking about, family practice. I'm talking about individuals that serve the Medicare population, talking about federally qualified health centers, hospitals. We want everybody that can vaccinate to vaccinate. And once they sign up into iCares, we can distribute that vaccine to those entities. And we're also setting up, different types of pods that we're going to be working with, or points of dispensing that we're working with partners to help us run those. And we will provide those different points of dispensing, vaccine. And some of those points of dispensings will be large corporations. Other ones will be school districts. So we're going to be very multifaceted, because our goal is, if we have the vaccine, we want to make sure that we can get it out in a timely manner. But the way to do that, we need to absolutely have enough vaccinators to provide the vaccine.
Perfect, and thank you. And I know a lot of people have been asking, like, how do I know that I registered correctly into AllVax? And I think when I registered, it showed like, thank you for registering, right, at that time. And then I think you were saying, Mark, people who registered can expect to start receiving an email. Was it this week or next week?
Yeah, actually this morning, for those of you that are already registered, you would have got, if you haven't had a vaccination yet, you should have received a AllVax email today, just reminding you that yes, you are registered. When it is your time, you will be notified. And when you are notified, then we're going to be asking you, when would you like to schedule an appointment? Because that's the way our system works, is that, we aren't going to be sending this weekly, but what we will be doing is sending out very timely messages as we have additional information. So for example, next week, we'll be sending out an email through AllVax to ask people to update their accounts, because we're going to get a better idea of the frontline essential workers that are out there.
Perfect, thank you, because I know people were concerned about that. So I think I heard you say we're going to get appointments. AllVax, when it's somebody's turn, they're going to learn about that when they get that notification. Should people just wait to be notified if they've registered in AllVax, or should they be contacting their doctor also?
Yeah, I mean, again, I think you should always, you should call your provider and ask them if they plan on getting any COVID-19 vaccine. And if they are planning on it, when do they think that they would be able to start vaccinating you as a patient? Also, I know we've been working very closely with our hospital presidents across Lake County. They are continuing not only to vaccinate their own staff, but they've started vaccinating dentists, they've vaccinated physical therapists, occupational therapists, other people that are healthcare workers that are outside their system. So they're continuing to do that. So they've been a great partner. And then if you live in another county, I mean, one thing that Lake County is doing, just like all the other counties, we are vaccinating anybody who lives or works in Lake County. So if you not work in another county and you can get the vaccine, go for it and get the vaccine, because every vaccine will be entered into the iCare system, which is the vaccine registry in the state of Illinois. So even if you get a vaccination somewhere else, that information will be transferred into our AllVax system. So we will know if you got a vaccination in Illinois, is that we will know that you got a vaccination.
Okay, perfect. Thank you. And, I would just say that if people have checked their email and they don't see an email from AllVax, I'd recommend checking your clutter or your junk or your spam folder just in case. And then if you haven't gotten it, I don't think it would hurt for somebody to re-register and make sure that information is in there.
Well, Chair Hart, I'm glad you brought that up, because you don't really need to re-register, but what you should do is, when you get those emails from us and we ask you to go back in, you can always log in, you can always update information. Dr. Ahmed is going to be talking about some of the underlying conditions that have been added. You can go back in and put in a different underlying condition. Our team really wanted to make this user-friendly for all of you, and we wanted to be able to update it as the science changed or as the phases changed, and the underlying conditions change. So it's very user-friendly. Just log in and make edits to your profile at any time.
Perfect. Thank you. So speaking about Dr. Ahmed and underlying health conditions, could you speak to that, Dr. Ahmed? When will some people with those underlying health conditions be able to get vaccinated? And I know that we're only talking about certain underlying health conditions and not others. So can you help us understand why that would be?
Sure. Thank you, Chair Hart, and good evening, everyone. I am very grateful for the opportunity to have to address all of you tonight. Talking about underlying conditions, I think what's really important to understand is that the Illinois Department of Public Health, based off of the CDC's guidance, has provided a breakdown and details of who is in phase 1A and who's in phase 1B. Phase 1A, as you know, includes healthcare personnel and long-term care facility residents. Phase 1B includes individuals that are greater than 65 years old, which is a large segment of our population who have medical illnesses and underlying conditions. Likely individuals who are 16 to 64 years old with certain underlying medical conditions may be eligible for vaccine in phase 1C, but we await final confirmation from the Illinois Department of Public Health. Our Lake County Health Department currently follows the guidance provided by CDC on developing our list in AllVax for the list of conditions that are considered at high risk for developing severe illness or death from COVID. And that's based off of the list that the CDC has provided. And the way that the CDC has developed that list is by gathering data showing that people that have specific underlying conditions can't lead to severe illness and death. And that list currently includes conditions that cause a weakened immune system, such as individuals who've had transplants of solid organ transplants or bone marrow transplants or have HIV, individuals that use medications that weaken their immune system, individuals that have chronic kidney disease or Down syndrome or heart conditions that may lead to having severe illness with COVID. And also included in that list is obesity, severe obesity, pregnancy, smoking, and type 2 diabetes. Now, there might be a couple that I've missed, but I believe they'll be putting in the link to the CDC website in the chat box that you can look to see what those conditions are. Now, there have been a couple conditions that have been added fairly recently in the past 7 to 10 days, and the AllVax portal will be updated with those conditions very shortly, and you will probably get a notification in your email to go back in and modify anything in your registered profile.
Thank you. So if somebody does have a health condition that you've talked about, or maybe one that you haven't, should they move forward and get the vaccine? What should they do?
That's a really good question. And, the Lake County Health Department and myself, I would recommend that you talk to your healthcare provider, in particular, the specialist that is managing that condition. They'll be able to sit down with you to explain the benefits, the risks, and help you make an informed decision. If the benefits outweigh the risk, then your provider or the specialist may recommend that you go ahead and get the vaccine.
Okay, thank you. Can you talk a little bit about the side effects? I know I read some scary stuff, but then other people said, it was no big deal at all. It was like a flu shot. So are there certain things that people should worry about, or?
Sure. So there are expected side effects from any vaccine, and those expected side effects are the same for the COVID-19 vaccine. We expect that after a person gets vaccinated, either with the first or second dose, that they may have a low-grade fever, they may have headaches, they may have some muscle aches and fatigue. Usually those symptoms resolve after 1 to 3 days after getting vaccinated. And again, this is very similar to other vaccines and what we expect with other vaccines. And we've got a good understanding of the short-term effects based off the clinical trials. However, it takes a little bit more time and more people getting vaccinated to learn more about the long-term effects. And that's why safety monitoring is important. There are several ways that the CDC is monitoring for safety in the state as well. And they've come out with a new smart app tool called vSafe that after a person gets vaccinated can download onto their phone, and the CDC checks in on you every day for a week and then weekly thereafter. And it's great. And they, if you have any symptoms of concern, you let them know, and they may even reach out to you. So there are various ways that safety is being monitored. And if they identify any possible problems, they will investigate immediately.
Perfect. Thank you. So this is a question I think for Mark, but that's up to you guys. You were here for the H1N1 pandemic, and you talked a little bit about how the flu shot is different from this shot. It feels like it's taking a long time. Can you just help us understand, is it taking a long time? And if you could just speak to that, please, and how maybe this is different.
Yeah, actually, I think this is where, these vaccines are really an absolute miracle. I mean, the fact that we even have a vaccine that has been developed in such a short time, but very effective and safe vaccine in a short time, that we have it manufactured and that it's already being delivered is just an absolute miracle. But again, going back to some of the issues with the vaccine is there's not a lot of supply yet. It's brand new, so they're pushing it out. So there has been some shortages of vaccine in the beginning. But again, the bigger issue is once we start getting a greater supply, we need as many vaccinators as possible, because this vaccine takes 2 doses and there's so many logistics around it. So once you pull that vaccine out of the freezer, you have to thaw it. You have to then mix one of the vaccines with a diluent. You have to put it in a syringe. That syringe has to be used very quickly, and we have to make sure we're injecting it into somebody's body quite quickly. And then after we finish that vaccination, is that we have to bring people back 21 days later for the Pfizer vaccine and 28 days later for the Moderna. So not only are we having to give 1 dose, is that you're doubling the time because you have to give 2 doses. And we want to be right around that 21 and 28 day mark, because once you have that first dose, you build some immunity, but really it's important to have that second dose. So again, these are minimums. Is that the Pfizer, we want to wait a minimum of 21 days before you get that second dose. And then it's a minimum of 28 days for the Moderna.
Perfect, thank you. So just to follow up, it would sound like you maybe need some volunteers or people who are vaccinators. Would that be correct?
Yeah, so what we would love to have is, again, the hospitals have been a great partner, the school districts have been a great partner, the corporations are a great partner, is that we want everybody that can either have or has vaccinators right now or can hire vaccinators, to do that. So then we as a health department, when we have a supply of vaccine, that we can distribute it to those entities and they can start vaccinating right away. So, to your earlier question is, the appointments that you're making in AllVax, are coming to us right now, but later on, you may be making an appointment for a closed point of dispensing, at a school. You may be making an appointment at your corporation. So these are the things that, as we build out the supply of vaccine, there's going to be more locations. But again, we want everybody that can be a vaccinator to figure out how they can be a vaccinator. And one way providers can do that is to sign up into the iCares vaccine registry.
Okay, perfect. Thank you. And then I think you had told us in a meeting just last week that for every vaccinator, you need like 3 or 4 people to support that vaccinator.
Yeah, so that's another thing too, is that it's not just having vaccinators, because again, with these vaccines, there's a lot of different things, logistics that we have to do. So when you first come in, so we're doing drive-through vaccinations right now, but we have to have crowd control. We have to have people checking to make sure, who is coming. Are you the one that was registered? Are you the one that should get the vaccination that day? So we have people that are scanning in the AllVax system. You're scanning the QR code. And so we know it's you, and then we bring you through. So people have to direct you. Then you come up to the vaccinator. They ask you a couple of questions. They give you the vaccine. And then after that, then you go into another line, and then you can either wait 15 minutes or 30 minutes, because we want to make sure that you're not going to have any effects before you start driving again. So yeah, so for every vaccinator, we need about 4 other people, because there's people behind the scenes too that are mixing the vaccine, that are drawing the vaccine. And so it's a very large operation. It's not as simple as just sending, a nurse over and start vaccinating.
Perfect. Thank you. I know that was really eye-opening for us. And so I appreciate you speaking about that. It's, again, as you said, it's not like the H1N1 flu vaccine. So thank you. I have a question for Dr. Ahmed. Since the start of the pandemic, somebody had sent this in, obviously, since the start of the pandemic, we've been hearing about the disproportionate impact on low-income communities and people of color. Does the vaccination plan address this disparity?
Thanks, Chair Hart. So the phases and the way that they were developed by the CDC and IDPH do address, to some extent, individuals and populations that are at higher risk of having carrying the burden of disease and having deaths. And so, as you know, the first phase 1A, we had healthcare personnel and long-term care facility residents, because healthcare personnel were at the front lines and they were getting sick. And we've heard stories about that anecdotally. Additionally, we know that long-term care facility residents have had a disproportionate amount of disease within their facilities, and over 60% of our deaths in Lake County were among long-term care facility residents. And so inherently within the phases, we do have an accounting for that disparity that we are seeing in healthcare access. Additionally, the Lake County Health Department is taking on extra effort as well to look at our data, look at facilities and institutions that have been profoundly impacted by illness and death. And so we are also targeting those as a subcategorization within the phase. So let's say we move to phase 1B, we know that there are certain populations within phase 1B that have been severely impacted. And so we will make sure that we reach out to them and work with them and coordinate with them to get them vaccine as quickly as we can. And one example of this was in phase 1A currently. Like, we have the pharmacy partnership program that the federal government has sponsored, and right now they're working through the skilled nursing facilities because those were heavily impacted. Then they will follow through the other various facilities that have long-term care facility residents. So it's very, very important to understand that currently the phases have that built in, but the health department is working also to target populations that we know that have been heavily impacted to make sure that they are vaccinated and protected as quickly as they can be.
Perfect, thank you. So there, a lot of people were asking about children and when they would be able to get the vaccine, and certainly there's children who live with underlying health conditions. Can you tell us a little bit about the guidance for children, if it differs, I guess, under the age of 17, or what the cutoff is?
Sure. So right now, the Pfizer vaccine is recommended for individuals that are 16 years and older, and the Moderna vaccine is currently recommended for individuals that are 18 years and older. Now, there are currently studies that are ongoing that are looking into children between the ages of 12 and 16, or 12 and 17 respectively, for the different vaccines. We're hoping that those findings will be shared in the coming weeks, and hopefully in the coming months, we might get recommendations from the CDC and subsequently IDPH about children.
Okay, thank you. So how are we ensuring that the people who are supposed to get the vaccine in the certain phases are getting it? I know that, you know, we all hear about, oh, so-and-so got the vaccine and they don't even have an underlying health condition as far as we know. So can you talk a little bit about that, please? And maybe that's a Mark question.
I think it's a good one for Dr. Ahmed.
Okay, thanks.
Sorry, Sandy, can you repeat the question again? How are you ensuring that people in their phases are getting the vaccine?
Yeah, and I guess, you know, and I saw a question come through like, hey, I heard so-and-so got the vaccine and they don't have an underlying health condition as far as that person knows. So I guess, does that happen? And if it does happen, can you help us understand why? And is that just because we want to make sure we don't waste the vaccine, or is there something?
Right, so a couple of things regarding that. So we are adhering to the CDC and IDPH guidance in terms of the phases. But there are logistical issues with the vaccine, as you can understand. Each vaccine vial contains a certain amount of doses. And once that vial is tapped into, all those doses have to be used in a certain amount of time or they go to waste. And so what the hospitals have been doing as they've been getting the large amount of and quantity of vaccines is that they are trying to vaccinate as many people within the healthcare personnel as possible. And occasionally what will happen is that, you know, by the end of that certain time frame, there will be leftover vaccine. And so at that point, it is encouraged and recommended that individuals, that other healthcare personnel be found in that time frame to get them vaccinated. And so I know that Mark and I've had to deal with situations from hospitals where they've called and asked, you know, what should we do next? And the recommendation has been, you know, call your non-affiliated urgent care center or an occupational health center next door or physical therapy center next door, call them, bring them over and use those extra doses. And if they're not able to find healthcare personnel and we're not trying to waste doses, then to go down to the next phase and go ahead and use those doses, extra doses, so we don't waste. The biggest thing and the biggest emphasis is that we are trying to use every single dose that is given to us and stick it in every arm and make sure everyone is protected. And at the end of the day, if there are remaining doses, we will do our best to find other individuals within that phase. And if we can't, we'll move to the next phase and we'll use it on that individual.
Perfect, thank you. I'm sure I speak for many when I say the last thing that we want is for doses to get wasted. I mean, that would be a tragedy. So thank you so much for answering that question. So how is the county keeping track of who is getting vaccinated? Is that just through the AllVax system? And that's for you or
yeah,
Mark?
No, and I could take that. So Alex, if you can just pull up that next slide. As you know, one thing that I wanted to really say is that, we're tracking the vaccines, but I know there's been a lot of questions that once you're vaccinated, what are you going to do? And what we want to make sure that everybody understands is even after you're vaccinated, we still want everybody to follow the 3 W's. We do not want to go back to where we were. And so we want you to still wear a mask. We want you to wash your hands, and we want you to watch your social distance. So that's going to continue. But going back to the tracking, the great news is with our AllVax system is that you will be notified when you're going to get your vaccine. And then the next thing that's going to happen is that you are going to get your vaccination. And then after 21 days, a week before 21 days for the Pfizer vaccine, and then a week before the 28 days for the Moderna, you're going to get another notice saying, okay, please remember to schedule your second appointment. And so we know when you got your vaccine, you'll get notification when you should schedule your second vaccine. And the nice thing is our AllVax system, actually communicates directly with the eye care registry. And so even if you got your vaccination, as I said before, at another location, that eye care registry will come into our AllVax system. So we will know you had a first dose, but then we will still notify you that you have to get your second dose. So AllVax system tracks that and notifies you on both doses.
Perfect, thank you very much. So I think what you're kind of saying is once you get vaccinated, it's not like we can go back to pre-COVID life.
Absolutely, and that's where, I think there's just been a lot of conversation about, yay, we got the vaccine, and I agree with everybody. We all want our lives back, and I hope every one of you is going to get your vaccination. And so that's our other hope, is our goal is to vaccinate over 80% of the Lake County public. We really want that herd immunity, which is about 560,000 people, but we really need you to continue to follow the 3 W's. It's so important because this vaccination campaign is not going to happen quick. We request your patience, and we're in this for at least a year.
Okay, that's kind of sobering. So I see that IDPH has a new, I think it's a new website. It's like a vaccine data webpage, and it's tracking vaccine distribution. So can you, and then there's like a little graph that shows how different counties are doing and things like that. Can you kind of tell us how Lake County is doing in getting the vaccine out to people?
Yeah, so what the Illinois Department of Public Health put out yesterday is that they are tracking how many doses how many doses of vaccine have been provided. They're also tracking how many individuals are fully vaccinated. And so you're going to see a lot of disparity across the state of Illinois. And that's not necessarily because one county is better than another. It really reflects, how many of those counties, because we're in phase 1A, some of the downstate counties do not have any hospitals. They don't have very many healthcare workers. So when they say we're already done with phase 1A, because they have a limited number of people that are in that healthcare worker or phase 1A status. And so in Chicago, Cook County, Lake, DuPage, we have 6 hospitals here in Lake County with thousands of employees. And so it's going to take us longer and Cook County longer and DuPage County and City of Chicago longer because we have more healthcare workers that we have to vaccinate. And when we say healthcare workers, that's not just doctors and nurses. Again, as we said before, this is dentists. This is, other individuals, people living in skilled nursing facilities right now for long-term care facility, residents and staff. There's a lot of people in phase 1A. So you're going to see variability between the counties as to what the progress is. But again, our progress is really dictated by the supply of vaccine and the number of vaccinators that we have.
Perfect, thank you. And again, with you guys purchasing that deep freezer, I mean, I do know is the Moderna vaccine, right? It's like direct shipped right to Lake County.
Yeah, so while we get the both the Moderna vaccine, which can be held in a general freezer, and then the Pfizer, which goes into our ultra cold freezer. But yes, both of them are directly shipped to Lake County.
Perfect. Thank you very much. So can people who are employed in Lake County, but they don't live here, maybe they live in Wisconsin or whatever, I think you said they can register on AllVax and receive the vaccine. Is that right?
That's absolutely correct. So we want everybody to know that if you live or work in Lake County, we want you to register into AllVax. We will vaccinate everyone. Why would we do that? Why would we vaccinate everyone? Because people are coming in, they're working, they're side by side our residents. We want everybody that works as well as lives here to get high enough immunity so we build herd immunity across the county. So actually I have staff, medical people that work or live in Wisconsin that we've been vaccinating. We have hospital systems where individuals live in Cook County, so we've been vaccinating those individuals through the hospitals. So it doesn't matter where you live, it matters where you live and work. And so as long as you live and work here, we will vaccinate you.
Perfect, thank you. This question I think would be for Dr. Ahmed. If my spouse is high risk, but I'm not, will we both be able to get the shot at the same time?
Thanks, Chair Hart. So before I answer that question, I do want to add a comment. One is that right now we have been giving majority of our supply of our vaccines to our hospital systems, as Mark has mentioned. The remaining supply, very small amount of supply that we have, we are currently using to try to vaccinate through 1A. Now, as the weeks pass, we will get more and more vaccine. And for that reason, Mark is talking about expanding out our network of partners that will be willing to vaccinate. So right now, currently, given the supply that we have, we are working on actively vaccinating, but at the same time, as supply increases, that is why Mark is talking about expanding that network. Moving on to the question that you had brought up about spouse having a high risk condition and the other spouse not. At this time, because the vaccine supply is limited, the spouse that has a high risk condition or is at high risk of developing severe illness from COVID-19 will be prioritized first to ensure that they are protected from the virus. When vaccine becomes more available and as we move through the phases, the other spouse then, when they are eligible, will be vaccinated. This is something that's currently occurring right now. If you think about it, healthcare personnel that are the only healthcare personnel within their family are driving up and getting vaccinated while the remaining of their family are waiting for their phase so that they can be eligible.
Got it, thank you. So should somebody get the COVID-19 vaccine if they recently got like a shingles shot or just other vaccines? Is there a risk there?
So that's a good question. According to the CDC, a person should wait 14 days before or after getting any other vaccine prior to getting the COVID vaccine. And the reason is that we really don't want to have we really want to promote a good immune system response. And so, I think it's really important that you wait the 14 days prior to coming in and getting the COVID vaccine. So really, if you're planning to get another vaccine, talk to your doctor about that you're eligible for the vaccine, that you're scheduling an appointment so that you guys can work out a schedule of how to get, let's say, the flu vaccine, and then 14 days later, the COVID or vice versa.
Okay, thank you. So that's kind of tricky because if somebody's in sort of that 1A or 1B, and maybe they really need this like other vaccine, they kind of have to measure what to do there, right? So talking to their doctor. Okay, all right, thank you very much. That would be a tough position to be in. So do you need to get both vaccines from the same manufacturer? Or can somebody choose which one they want? Or could you start with one and then end up getting the other? Let's say if I, live in Wisconsin and I got my first vaccine here in Lake County, but they're offering it from a different manufacturer in Wisconsin and it's my turn there. Can I do that?
So that's a great question as well. Currently, both manufacturers and the CDC recommend that you don't mix the doses. If you get a Pfizer vaccine as your first dose, then you get the second dose as a Pfizer vaccine. Because right now, the studies that have been completed in the clinical phase 3 trials have not looked at mixing the different manufacturers. So we don't really know what that impact will look like. So the recommendation is not to intentionally get a Pfizer as a first dose and a Moderna as a second dose, but to get the same vaccine, the first and second dose. And
Okay.
in terms of choosing your vaccine, supply is limited, and whatever we have at the time, that is what that individual, when they show up through whatever site that they're getting the vaccine at, they will get that vaccine. Once supply improves later months down the line, that might be a different story. But right now, with limited supply, whatever is available at that site, that's what you'll get.
Okay, thank you. So are there any restrictions that would be in place after somebody has received the vaccine? So like what level of protection? I think it varied, right, with each manufacturer. So like first dose, you're protected X%, and second dose, things like that.
Yeah, so after the first dose of the mRNA vaccine, they think that you might have approximately 50% efficacy of that vaccine. After the second dose, several weeks after, you might confer that 95% vaccine efficacy, but it can vary across people. There's a lot of factors. It depends on the person, their overall health, and so forth. I think we're still learning so much about the vaccine. There still needs to be studies looking at the overall impact of the vaccine over time. What I think is really important to understand is that individuals that are vaccinated will be protected or have some level of protection. But until we learn more about the vaccine and if vaccinated people can spread to others, it is important, as Mark mentioned, that you practice the 3 W's, that you watch your distance, you wash your hands, and you wear a mask. And just know that, once you get vaccinated, it's not a ticket to stop doing any of those things, but those precautions still need to continue as we learn about the impact of the vaccine.
Okay, thank you very much. So we'll be wearing masks for a lot longer is what I think I'm hearing you say, right?
Yes.
Okay, thank you. So I know, Mark, you had said that we're partnering like with doctors' offices, and as we get more of the vaccine, we can expect more people to, to be able to go to different places. Does that include pharmacies and things like that?
Absolutely. And again, that's another group that I know the Illinois Department of Public Health is working with on 2 things. One is that CVS and Walgreens is actually doing the vaccinations at our skilled nursing facilities in Lake County. And I do get a lot of questions, Chair Hart, on, well, when will they move to assisted living? And so the good news is that the Illinois Department of Public Health and CVS and Walgreens are 1 week away from giving the first dose to all residents and staff that want it in skilled nursing facilities. So we expect that assisted living and independent living, those locations will start being vaccinated in about mid-February. So it's coming, but the IDPH prioritized the skilled nursing facilities first. But as far as individuals, absolutely. We are hopeful that pharmacists, Walgreens, Jewel Osco, Walmart, wherever there's a pharmacist that can vaccinate, we'll get them vaccine. And so we hope there are multiple outlets for people to go to throughout Lake County to move this along quickly.
Perfect, thank you. So one other follow-up, and we talked a little bit about the Wisconsin, let's say you get one shot there, but then it comes up in Lake County. So you just have to it sounds like it's better if you just stay within your state, right? Because you don't know, like you wouldn't know in Wisconsin if they got the Pfizer vaccine or the other vaccine, right?
Yeah, I mean, again, if you can get it in Wisconsin, then you can get it in Wisconsin. I mean, both Wisconsin and Illinois will have Moderna and Pfizer. We are all looking at, I mean, the only difference would be, is there may be a shortage of supply if you had a lot of people getting the Pfizer vaccine, and then let's say came to Illinois, but then we didn't have a lot of Pfizer vaccine. Ultimately, somebody would get it. But again, that's something that you can get it in other locations. The only problem is if you get it in Wisconsin, the information will not be transmitted into the Illinois system. So if you get it in other Illinois counties, is that it will all go into the same the immunization registry. But again, if you can get it, you might as well try and get it if you want it sooner than later.
Okay, perfect. But it sounds to me like, people can follow up with their doctor, but if they register in AllVax, that's a really great way for us to kind of, I don't want to say keep control over it, but just ensure that people are getting notified, things like that. Is that accurate?
Yeah, again, if you go to Walgreens or to CVS or to Walmart and get your shot, that's fine. We actually hope that you're able to have those different venues. And then really the AllVax system is just making sure that you're notified when your time could come that you could be scheduled and go get that vaccine. So there's no harm, no foul by being in AllVax if you go somewhere else. But again, we have that system that for our sites or other sites that will be using the AllVax system to schedule and to track, again, we want everybody to register, to be notified, or to potentially schedule appointments and get your vaccines through that system.
Okay, thank you. So we do have a number of questions. People were saying, I'm nervous about taking the vaccine. It usually takes, I don't know, years so that we know that it's safe for the public. But, this has been a much faster process and I'm a little afraid of it. So how, I guess this is maybe for Dr. Ahmed, how would you respond to that concern about people worried about the safety of it?
Sure. So I think one thing that we need to understand, and what I'd like to emphasize and stress, is that all of the steps that were taken to evaluate the safety and efficacy of this vaccine were the same that were taken for any other vaccine that are on the market. They went through the same phase clinical trials that were funded from the federal government. They were reviewed by the FDA's review board, which is called Vaccines and Related Biological Products Advisory Committee. They were reviewed by an independent committee called the Advisory Committee on Immunization Practices for Safety and Efficacy. And both of these independent committees evaluated the science, and they're all composed of experts on these panels. Now, I think, people are concerned about the speed, but the speed truly was a miracle, as Mark said, because if this pandemic had occurred 5 years ago, we probably would not be in a place to have developed a vaccine within a year or in a year's time frame. And the reason is because the research that went behind these mRNA vaccines have been research that has been worked on for almost 25 years, decades. And the fact that the research was where it was at the time where this pandemic hit, the fact that they were able to sequence the strain and take a look at that strain, the fact that the federal government had provided billions of dollars to try to streamline and get manufacturers to sign on to produce this vaccine. I mean, all of that put together really set the tone to have that vaccine available within a year. And so I think, I want everyone on this call to be assured is that, the safety, none of the steps were skipped. It's just that the speed truly was a miracle because everything was lined up for it to happen.
Perfect. Thank you very much. I know I've heard that same concern myself. And is the vaccine free for everybody?
Yes, go ahead, Mark.
Yes, it's free. So, this is part of the strategic national stockpile. So the vaccine is being provided free by the federal government. So if you came to one of our vaccination sites, is that you would have no charge at all for any of that service.
Perfect. Thank you very much. So is there going to be, I know we talked about AllVax and then the eye care system and things like that. So is there sort of a national record then that everybody has gotten vaccinated?
No, so unfortunately, there's not a national registry that all the systems plug into. But again, what the state of Illinois is doing is they are pushing information back to the federal government as to how many people got registered or vaccinated in Illinois. So that's how they're keeping track of it at a national level. But unfortunately, we don't have a single national health registry for everyone across the United States. So they're fragmented.
Thank you. So I have read about some reports. People are saying, oh, well, I know if I pay $100, I can get the vaccine faster. Or I registered through the mail, somebody sent me something, and so I registered that way. Can you speak to that? I feel like I've heard a little bit of, I don't want to say that they're all scams, but I have heard about people being taken advantage of.
Yeah, we really want our Lake County public to be very careful of, a shop setting up and saying that they're going to give COVID-19 vaccinations. Is that, you want to make sure that your provider has received the vaccine from the health department, because again, this is something, or had a direct ship to them, is because what some scammers are doing is actually finding the Pfizer boxes, the trays that they come in, and repackaging not vaccine, but something else, and trying to resell it. So again, everything that we get is coming direct ship from the federal government, from the manufacturer. So we know that is the appropriate vaccine and is tracked. These kits come with GPS units. When they come, they have temperature logs on them. We know that the vaccine is great to go. And just something else, Chair Hart, is that I did see in the chat that there were some people concerned that, like Walgreens or CVS didn't have an ultra cold freezer. You don't have to have that. Once we pull it out of the freezer, again, that pharmacy has 5 days for Pfizer or 30 days for Moderna to keep it in the refrigerator. And these pharmacies do have refrigerators. It's just that they have to utilize that vaccine within that 5-day or 30-day time frame.
Perfect, thank you. So I'm looking on my clock, it's 7:58. And I want to start with Dr. Ahmed. Just if there's anything that wasn't asked that you want to make sure you tell Lake County residents before we close. And Mark, I'll ask you the same question.
Sure. So a couple of things that I do want to end with my concluding remarks would be that I really want to urge everyone to register in AllVax. And if you're hesitating or have questions, go ahead and register. It doesn't commit you to having to get vaccinated, but at least register and have your name in there so that when there is vaccine available, you'll have time to contemplate, which way you're going to go, but you'll at least be able to be registered and know when you're eligible to get vaccinated. Talk to your healthcare provider. They are there. You've had long-lasting relationships with them. You trust them. Talk to them about your individual conditions, your health, and if they recommend that vaccine. And then most importantly, we're in this as a community together, from the start of the pandemic. And we want to make sure that you are all protected. And the best way to do that is to get vaccinated and practice the 3 W's. And if all of us can do that and a majority of us can get vaccinated, the better it is for our community and the better we prevent disease and death within our community.
Perfect, thank you. And Mark?
Yeah, so I just want to echo what Dr. Ahmed said, is that let's get our lives back. Let's get vaccinated. So if you have any hesitation, again, please reach out, look at our website. We're a trusted resource for you. Don't believe a lot of the things that you're reading out there on social media. Again, there's a lot of rumors, a lot of falsehoods. These are safe and very effective vaccines. And just to say, to have a vaccine that is 95% effective is phenomenal. And for all you providers out there, we will work to do anything we can to help you fill out your paperwork for iCares. We want you to get registered. We'll make it easy for you to get the vaccine, but we need all of you to help vaccinate our public. And just by the number of people on this call tonight, I'm so excited about the fact that we have so many people that want to get vaccinated. And then I know a lot of you want to volunteer. How do you volunteer? And so we do have what is known as the Medical Reserve Corps. And so that Medical Reserve Corps also has people that are not medical, but we need them to do direction, at the different sites. So if you want to volunteer, that you can call 847-377-8186. So that's 847-377-8186 to volunteer, or you can send an email to hlhealthem.lakecounty, or lakecountyil.gov. So that's hlhealthem.lakecountyil.gov. So thank you all. Keep doing what you're doing. We've made a lot of progress. Thank you for following the 3 W's. And again, we hope all of you are well, that you stay well, and that you definitely get your vaccination.
Thank you, Mark. And we're actually just a little bit over. I want to thank Dr. Ahmed and Mark for being here. And just personally, I want to say I'm just so grateful that they can do their work around public health and protecting all of us. And they can do that safely here in Lake County without threats and fear of retribution, which unfortunately their counterparts are experiencing in other parts of the country. We've been hearing terrible stories about that. And I'm just grateful that our residents here in Lake County understand how important their work is. And I know I speak for the entire county board when I say we are so grateful to have them here, grateful for their expertise and everything they do every day to help us. I also want to thank everybody for joining us this evening, and a big thank you to our great communications team for their hard work. We could not do it without them. They make us look good. So as a reminder, this town hall will be available online. You can visit lakecountyil.gov for more information. And as Dr. Ahmed and Mark said together, we're only going to beat this if we work together. So thank you again for all that you're doing during this difficult time, and just staying safe, washing your hands and wearing a mask. So please stay safe, stay home, stay healthy. Thank you so much. Take care.